Welcome back. It is 9:23. The AToN Center remains open and continues to care for its patients during this pandemic. Here on the phone to talk with us about how the rehab center is adjusting is Leslie Sanders, Program Director at the AToN Center. Good morning, Leslie.
Good morning, Lauren. How are you?
I'm wonderful. Thank you for asking. Let's talk a little bit about first what the center provides and how this whole pandemic has really changed things for the center service.
Yeah, absolutely. So AToN Center is a residential detox and residential rehab program. We treat residents with substance use disorders, may it be opiates, alcohol, all sorts of drugs. And we're located here locally in Encinitas in a rural area. And basically, we're considered an essential healthcare business. So we feel like we play an important role in the local healthcare system. We're licensed and certified by the California Department of Healthcare Services to provide the residential treatment and residential detox.
And how has this pandemic really changed your approach, your business, and how you're helping residents who really need an important part, as you mentioned, an essential service?
Well, yeah, we feel like, one of our major roles in this crisis is to continue helping the individuals that we always help in our treatment center. And we do allow appropriate individuals to come to AToN Center to detox. So that does free up additional resources for our hospital workers and allows them to focus on the COVID-19 crisis. It also prevents people that need to seek out detox from unnecessary exposure in our emergency rooms. So AToN Center is really focused on providing a safe program for all of our residents and for our staff. So our main priority is safety and keeping our staff and our residents healthy. So we are adhering to all the CDC recommendations and the County of San Diego guidelines. Like I mentioned, we operate here in Encinitas out of 5 upscale homes. They are adjacent to each other. And due to the COVID-19 emergency, we've changed a couple of things about our program. So one thing in particular is we have chosen to provide all incoming residents with private room accommodations versus having shared rooms. This just allows people to adhere to social distancing guidelines. We've also decided to operate each house separately. Sadly, we've had to discontinue some things like off-site exposure outings and community support meetings and visitation, but we've made good use of platforms like Zoom to engage with our local community and make sure that our residents can keep in contact with their loved ones.
Have you found this to be more? Have you found it to be more stressful for your residents that are at the center, or maybe a spike an increase in need as far as members of the community who are finding it in an especially stressful time?
Yeah, I think everybody is experiencing increased stress at this point in time. I think, our focus is to continue providing high-quality clinical services and holistic care in a comfortable atmosphere. We emphasize cognitive behavioral therapy and incorporate a variety of other evidence-based modalities. We prioritize physical health, so we want to encourage our residents to exercise in our on-site gym, participate in yoga, physical therapy, massage, breathwork, meditation. And, our goal is really that they learn tools to deal with their maladaptive patterns of using substances. And the takeaways from our program are definitely skills that will be beneficial for anybody dealing with stressful situations and including COVID-19.
Yeah, well, it's great that your center is adapting like so many other businesses during this time and continuing to provide a service. Thank you for your time this morning, Leslie. I really appreciate it.
Yeah, have a great day. Thank you, Lauren.
You too. Be well.
Bye-bye.
Well, Mama's Kitchen hits its 6th consecutive week of record meal deliveries during this pandemic. Casey McKinnon is